Hi friends, today we will discuss regarding previous question papers of Sri Chitira Tirunal Institute of Medical Science. This is 2015 question paper, part 1. We will discuss. The first question is the hierarchy of needs where nurses prioritize basic physiological needs is identified by options Sigmund Freud, Kubler-Ross, Erik Erikson, Abraham Maslow. Answer D. Abraham Maslow. Second question. The most reliable index of the cerebral status is. Options are pupillary response to pain, level of consciousness, deep tendon reflexes. Answer is option C. Level of consciousness. Which one of the following is a water-soluble vitamin? Options: vitamin A, vitamin C, vitamin D, vitamin K. Answer is option B, vitamin C. Next question. You have a stock solution of 20%. To prepare 1 liter of 5% solution, how much diluent will be added? Options are 100 ml, 150 ml, 200 ml, 250 ml. Correct answer is option D, 250 ml. Fifth question. The antidote to heparin is. Options are calcium gluconate, vitamin K, protamine sulfate, atropine. Correct answer is protamine sulfate. Next question. For a comatose patient, the highest priority nursing diagnosis is. Options are altered sensorium, ineffective airway clearance, impaired physical mobility, altered nutrition. Correct answer is ineffective airway clearance. Next question. In a patient with decorticate posturing, the nurse observes options flexion of elbow, extension of knees and plantar flexion of feet, flexions of upper and lower extremities, extension of upper and lower extremities, extension of elbows and knees and flexion of wrist. Correct answer is flexion of elbows, extension of knees and plantar flexion of feet. Eighth question. The normal central venous pressure reading is between. Options are 0 to 5, 5 to 10, 10 to 15, 15 to 20. Correct answer is between 5 to 10. Ninth question. A patient with congestive cardiac failure experiences dyspnea due to. Options are accumulation of fluid in the interstitial spaces and alveoli of lungs, bronchial secretions and spasms, pulmonary embolism, pulmonary congestion resulting from cardiomegaly. Correct answer is option A, accumulation of fluid in the interstitial spaces and alveoli of lungs. Next question. A client on anticoagulant therapy is specifically monitored for options nausea, chest pain, insomnia, hematuria. Correct answer is option D, hematuria. 11th question. The nurse who observes projectile vomiting in a newborn suspects. Options are Tracheo-oesophageal fistula, Hirschsprung's disease, congenital hypertrophic pyloric stenosis, congenital heart disease. Correct answer is congenital hypertrophic pyloric stenosis. Option C. Next question. A person with diabetes mellitus is asking you the calories obtained from 1 teaspoon of sugar. Your answer would be options 5, 15, 20, 60. The correct answer is 1 teaspoon of sugar having the calorie of 20. Next question. Which of the following food items are rich sources of vitamin A? Options are green leafy vegetables and yellow fruits, green gram and dal, rice and potatoes, milk and milk products. Answer is option A, green leafy vegetables and yellow fruits. Next question. The urinary output of a client for 24 hours was 350 ml. The nurse has documented the observation as options are anuria, polyuria, dysuria, oliguria. Correct answer is oliguria. Next question. Which one of the following terms indicates increase in the size of cells without increase in the number of cells? Options are hyperplasia, hypertrophy, dysplasia, atrophy. Correct answer is option B, hypertrophy. Next question. When the client can breathe only in upright position, it is termed as options are orthopnea, dyspnea, tachypnea, apnea. Correct answer is option A, orthopnea. Next question. A client with hypoventilation is prone to develop options are metabolic acidosis, respiratory acidosis, respiratory alkalosis, metabolic alkalosis. Correct answer is option B, respiratory acidosis. Next question. Client after pneumonectomy will be options are supine position only, operated side or back position on, supine and either side, unoperated side or back. The correct answer is option C, operated side or back positioned on. Next question. When periods of hyperapnea alternates with periods of apnea, the breathing pattern is termed as options are Kussmaul's respiration, Chinese dog respiration, bradypnea, tachypnea. The answer is option B, Chinese dog respiration. Next question. Client who is sent home with an ileostomy requires dietary supplementation with options fiber, sodium, potassium, vitamin B12. The answer is option C, potassium. Next question. Client after liver biopsy should be vigilantly observed for options are hemorrhage, dyspnea, vomiting, pain. Answer is option A, hemorrhage. Next question. The rationale for using normal saline to start blood transfusion is the options are normal saline is commonly used as a primary IV solution. It is compatible with blood. Normal saline prevents hemolysis. Dextrose deactivates blood. The correct answer is normal saline prevents hemolysis. Next question. In case of blood transfusion reaction, the first nursing intervention would be options are notify the physician, stop transfusion, slow down the transfusion, administer antihistamines. The correct answer is option B, stop the transfusion. Next question. The priority nursing assessment in an immediate post anesthesia client is to options are monitor vital signs, check gag reflex, assess pain, assess airway patency. Correct answer is option D, assess airway patency. Next question. Alkylytic chemotherapeutic agents used in cancer treatment acts by and options are damaging DNA in the cell nucleus, destroying messenger RNA, creating a hormonal imbalance, interrupting cellular metabolism. Correct answer is option A, damaging DNA in the cell nucleus. Next question. The most informative measurement for determining cardiogenic shock is options are cardiac output, arterial blood pressure, oxygen saturation, central venous pressure. The correct answer is option A, cardiac output. Next question. The normal pH of blood is, options are less than 7, between 7 to 7.35, between 7.35 to 7.45, less than 7.45. The correct answer is option C, 7.35 to 7.45. Next question. Normal serum potassium is, the options are 2.3 to 3.5, 3.5 to 5.3, 5.32 to 7.5, 7.5 to 8.9. The correct answer is normal serum potassium is option B, 7.5 to 5.3. Next question. Normal serum creatinine is, the options are 0.5 to 1.5, 1.5 to 3, 3 to 5, 5 to 8. The correct answer is option A, 0.5 to 1.5. Next question. Normal glomerular filtration rate in male is, options are 95, 110, 125, 150. The correct answer is 125. Next question. Normal serum albumin is, options are 1.5 to 3, 3.5 to 5, 5 to 7.5, 7 to 10. The correct answer is option B, 3.5 to 5. Next question. Vaginal examination is indicated when membrane ruptures spontaneously in a pregnant woman with polyhydramnios 2. Options are assess fetal maturity, note the position of the fetus, determine stage of labor, rule out cord prolapse. The correct answer is rule out cord prolapse, option D. Next question. Which one of the following is a major cause for atonic postpartum hemorrhage? Options are infection, retained products, systemic lupus erythematosus, jaundice. The answer is retained products, option B. Next question. Normal respiratory rate in a newborn is, options are less than 20, 20 to 40, 40 to 60, greater than 60. The answer is option C, 40 to 60 beats per minute. Next question. The most accurate area to check the pulse rate in an infant is, options are carotid artery, brachial artery, temporal artery, apex of the heart. The correct answer is option D, apex of the heart. Next question. Staff nurse who was called by the nursing superintendent for a feedback on poor performance spent the remaining time of the shift blaming her supervisor and colleagues. The mental mechanism used by her is, options are projection, reaction formation, rationalization, compensation. Answer is option A, projection. Next question. Which one of the following drugs is a mood stabilizer? Options are Librium, lithium carbonate, tofranil, haloperidol. Correct answer is option B, lithium carbonate. Next question. The ECG recording of a client, the nurse observes tall peaked T waves, flat P waves, widened QRS complex, and prolonged PR interval. The nurse identifies, the options are hypokalemia, hyperkalemia, hypocalcemia, hypercalcemia. Correct answer is option B, hypercalcemia. Next question. The physician has prescribed 20 milliequivalent of KCl to a client. The available KCl is 10 milliequivalent per 5 ml. The nurse will administer. Options are 5 ml, 7.5 ml, 10 ml, 10.5 ml. Answer is option C, 10 ml. Next question. Which one of the following indicates increasing intracranial pressure following head injury? Options are restlessness, decreased pulse rate, increasing blood pressure, widening pulse pressure. Correct answer is restlessness. Following head injury, increasing intracranial pressure indicates restlessness. Next question. Which one of the following condition is a common cause of cardiogenic shock? Options are electrolytic imbalance, fluid overload, left ventricular failure, hypovolemia. Answer is option C, left ventricular failure. Next question. Which one of the following is the drug of choice in ventricular arrhythmia? Options are Integral, digoxin, sorbitrate, lidocaine. The correct answer is lidocaine, option D. Next question. Cyanotic spell is a feature of. Options are TOF, B.Sc, PDA, ASD. Correct answer is option A, TOF. Next question. An infant experiencing hypercyanotic spells is placed in. Options are high Fowler's position, knee chest position, prone position, supine position. The correct answer is option B, knee chest positions. So in this video we have discussed 45 questions. Balance question will be discussing on part 2. Thank you for watching. Please subscribe the channel for more question papers. Thank you.